Let's talk about how we're going to judge burns and the severity of these burns. We have a couple of criteria that we're going to use in order to make this determination. So, first, we have the depth of the burn. The depth of burn, we think in terms of the first, second, and third degree burns, how much tissue is going to be involved in this. We have next the extent of burn. So, this is the percentage of body surface area that's going to be involved in the burn. Third is going to be the critical areas, or if there are any critical areas involved. This is going to change things. Obviously, there are places in the body which are more significant if they're impacted by the burn than other places in the body. Pre-existing conditions is going to be the fourth sort of consideration. If someone has these medical conditions, some of them are going to impact their ability to manage themselves or to compensate for being burned in versus other patients. And then we have the fifth sort of consideration, which is going to be age. And patients that are younger than 5, older than 55, again, there's reasons why they may not be able to compensate or to be able to manage in the same way that patients that are not in those two age groups would be able to manage. So let's break into each of these individually, starting with depth. We have our first, second, and third degree burns for our depth. And this is just again involved with how many layers of tissues are we talking about here. So our first degree burns, really we think of these in terms of superficial burns. We're thinking about the epidermis, the sort of top layers of the skin being involved in the burn. Our second degree burn, you start getting into the dermal layer. That's where you start to see also blistering. And then our third degree burn is really where you're starting to get through the dermal layer into the subcutaneous layer, potentially down even into the muscle and bone. This is going to see that sort of charring, and you're going to kind of burn in the at least areas of the third degree. You're going to burn out the nerves, you're going to burn out pretty much everything that's in that area, destroy all of it. So that's our depth of burn. So we're going to judge that for our patients. Burn extent is going to be, again, the amount of area on the body that's actually burnt, surface area. And so we have what we think of as called the rule of nines. We see here examples of how that might look. To understand that so many different places can kind of change these numbers, you might have different age groups, and some of these numbers might shift for this. So this is just representative of the concept of the rule of nines, but you will see different versions of this. In this case, an adult, the head is going to be 9%. You're going to have the front of the body being 18% of the body surface area, with the back being another 18%, 9% for each arm, 18% for each leg, 1% for the groin area. And so this is going to be, again, kind of an easy way to quickly look at a patient and go, oh, well, the whole front of their chest is burned, so that's 18%. You can see that this changes a bit in terms of kids. You especially can see that the head now at 18%. This is just representing the fact that proportionally kids have larger heads than adults do. Front 18, back 18, 9 and 9 for the arms, and the legs are now 14%. The other way that you can go about this, other than the rule of nine, is the palm. So the palm is going to be taking and using the palm of the patient, and you can sort of estimate 1% of the body being the patient's palm. You can't use yours. Obviously, that doesn't work. It's not proportional to your patient, but you can use their palm and kind of estimate out percentages using that, especially for sort of smaller burns. You might use that method versus much larger surface areas you might estimate with the rule of nines. Critical areas that are involved. So if there are, again, specific areas involved, this is going to change the way that we prioritize these or categorize these. Might increase the severity if we have burns to the face, the facial sort of area, especially also airway, any kind of airway burn. And this is going to be significantly, kind of concerning for us in EMS and how we manage that patient. Hands and feet certainly are going to be significant in terms of being burnt. Genitalia is also going to be a important, and especially when you think of these two, face as well. Those you can think of in terms of the ability, like life, daily life, daily living. these are very important for being able to kind of move past this burn and be able to have, a normal life. So that's why these are considered. The other one that's important to think about is circumferential. If it's circumferential around the arm or around the chest, this is a problem because these need to be able to expand a bit, and the pressure that can build up when you have circumferential burns, you'll see a lot of times they cut little sort of slices into these to kind of open them up and allow pressure and allow them to expand. Pre-existing conditions. So patients that potentially have like diabetes or maybe renal failure or myocardial conditions, you can imagine all three of these might affect their ability to actually recover from this, maybe even try to maintain during the burn, and try to make up for any of these problems. So pre-existing conditions certainly is something that you have to consider. And again, if they have histories of these, it just increases your index of suspicion, makes you question whether they're going to be able to compensate in the same ways that a normal patient would. And then finally, we have age. Again, we said that, due to the developmental sort of issues as they're developing under 5, they may not have all of the pieces in place to be able to compensate normally. And then over 55, a lot of these compensatory mechanisms start to be impacted by both age, disease, also medications. All of these things can affect their ability to kind of manage themselves during burns.